The Montana Department of Public Health and Human Services has released its COVID-19 vaccination plan and coordination team. The team consists of representatives from hospitals, tribal governments, and other groups across the state. With more on the state's vaccination plan, here's MTN's Matt Holzapfel.
The state's COVID-19 vaccination plan is 38 pages long and answers questions like who will get the vaccine first in Montana and what locations can give those vaccines. At a meeting on Tuesday morning, the Department of Health and Human Services presented that plan and answered a lot of questions. There are still a lot of unanswered questions though, like which vaccine will Montana residents get? And how will the state handle vaccinating active COVID-19 patients? Let's break down what we know.
The vaccination plan that you have in front of you now is kind of our version 1.0.
The state expects this plan to change multiple times before it's finalized, but here are the highlights of the current plan. There will be 3 phases of distribution. In phase 1, limited supply of the vaccine will be available, and it will go to critical infrastructure workers, people at increased risk for severe illness as a result of COVID-19, and others. In phase 2, which the DPHHS estimates will be about 3 to 6 months after the initial vaccines arrive, people who are at increased risk of contracting or transmitting the virus will be prioritized. Then in phase 3, healthy adults with limited or no underlying medical conditions get their turn, as does anyone who has not already received the vaccine and wants to. Officials estimate that will be 6 months or more after the first vaccinations begin.
At this point, everybody needs 2 doses of vaccine. So in order to vaccinate what we would consider to be our healthcare settings, we probably need roughly 90 to 100,000 doses.
So what else? Well, if there are multiple vaccines available, we know that you must get the same vaccine for both the doses. No mixing Pfizer and Moderna or anything like that if multiple vaccines are available. Also, none of these vaccines are currently recommended for anyone under the age of 18. Becky says that's because there isn't data available yet on the effectiveness of these vaccines in children. And the state says these vaccines will be free for everyone, even people not covered by health insurance. For a full breakdown of the plan, including answers to some of your questions, head to our website. In Great Falls, Matt Holzapfel, MTN News.
The state says the vaccine won't be mandatory, but everyone who wants to get it will be able to eventually, and they estimate vaccinations could start as early as mid-December. And again, if you have questions about the vaccine that you want answered, you can email them to us at krtvnews@krtv.com.